Benmor Medical was established in 1996. At the time, there was no provision for plus-size patients, patients of over 25 stone, what we these days call bariatric patients. So there was a gap in the market. In those days, it was a very different business. A lot of the equipment was imported from overseas. In 2009, we took over the business, and we've established from what was a small business with 8 beds. We now have over 300 beds on the fleet and counting.
Here at Benmor Medical, we provide specialist care equipment for hospitals. Some of those pieces of equipment are for bariatric patients. These are patients who are over 25 stone, and that weight can affect them in how much weight the bed can take, and then also the size of the patient and how wide the bed needs to be, how long it needs to be. Another product we provide is the Primo, which is a floor level bed designed to stop people from falling so they can roll out of bed.
All our beds incorporate weighing devices, which is very important as one can imagine that for a plus size patient, probably the medication would need to be different to a person of a smaller size. As a mechanical engineer, I've spent a lifetime in the pump industry, oil and gas, pharmaceuticals, food. So we've had many opportunities to see the development of products. So coming to Benmor, I decided that the product really needed to be developed from the ground up that would better suit the patient and support the carer. So I brought that discipline in. It was always a dream that we would start to manufacture here in the UK.
This type of engineering is much more personal than, say, the designing of a car or an electrical system or modelling the process of flow through a pipe. And that's something that really resonated with me. So therefore I went on to study medical engineering at university. I did a bachelor's. I then went on to do a master's degree as well. There's a really nice family vibe to the business that kind of makes you feel welcome immediately. And Pete offered me an amazing opportunity to come in and start setting up the manufacturing, start building a team with some really experienced production guys, and kind of taking it on from there.
Before I came to Benmor Medical, I was working with McLaren Automotive in Woking. I was originally on the tools there in the paint shop. I was very lucky. I got an opportunity to venture out into the world of engineering. I took a position in SQA, Supplier Quality Assurance, and spent a number of years with them, learning the ropes with engineering and quality control. Quality assurance was great. I spent a lot of time with suppliers. I moved into production engineering, and actually at that point I got a call off Pete, and we discussed some opportunities here at Benmor. It was a new section of the business. We were starting a production unit. I was actually really keen to get here and do things that are working to benefit people. And I spent a lot of times working on toys, big elaborate toys, but toys nevertheless. And to come here and do something that I felt was a bit more meaningful was a really nice opportunity for me, and it gave me a good sense of achievement out of that.
I think it offers a unique way of applying your skills that have direct impacts on people's health. I think that's quite a rewarding way to work. Also, it's much more personal in that you can meet patients, you can meet carers, the people who are directly in this world of care, and being a part of that I think is something quite special.
Our headquarters are still in Hampshire, but we now have 5 locations in the North East, the North West, in the Midlands, the South West, and here in Hampshire. And over the last 3 years we've developed the manufacturing side, so we had more control over the design and production of our own beds.
British people are proud British people. You know, we've all got a good pride in our country. We like things that are built British. We build them well, we do them good. And customers like that. Customers like things that are close.
The rental service that Benmor supply to the NHS tends to follow the patient all the way through to the point of leaving the care of the NHS, perhaps moving on to a community hospital, and we hope back to their home. We supply, whilst in the hospital, the beds, the chairs, commodes, anything that the patient requires to get them speedily back to normal life. The hospitals want to get the patients better up and out. Our trained technicians will take the equipment, set it up in the hospitals. They will train all the users. Each of our 5 branches have a training facility, and they're fully in use, and we encourage and support NHS users with our training programs.
The future ambitions for this manufacturing team are quality products, growth of the team, and also innovation. What can we bring to the market that's going to change the game? I think that's the real focus for Benmor now.